Welcome to Kickin It with the Stanford Reach Lab. My name is Anagha.
My name is Julian.
And I'm Elias. And the topic we will be covering today is adolescent mental health and how it is impacted by the pandemic. I'd like to start off with an icebreaker. Hello, Julian and Naga. How is your mental health doing?
My mental health has been as good as can be given the current state we are in as a whole. How about you, Naga?
My mental health has been really good recently, and I definitely noticed that taking breaks has helped a lot. Elias, what about you?
For me, I think that coming back to school and being in person has definitely had a positive impact on my mental health. I think that the overwhelming sense of isolation and loneliness has left now that we have returned to in-person life. And Julian, if you could tell us how your individual community has been impacted by the pandemic so far.
There's a huge issue with homelessness in my area. For example, the Richmond, Berkeley, Oakland region. There's a lot of regions where, for example, Oakland, Berkeley Hills, and Richmond Heights, where there's people who are very comfortable. But on the other side of the coin, there's also a lot of people who are quite the opposite. There are people who are not that well off, such as the homeless. And given there's a homeless crisis in my region, especially in California, there are a lot of people who are sick, a lot of people not getting the resources. They're not in a place where they can have a warm bed, a clean shower, a nice warm shower, great food, but they're actually just quite literally living in unlivable situations. It's really sad and really disheartening. That's the matter of how it is at the moment, and we do need to be honest with ourselves. But that's just my region. So what about you, Naga? How is your region doing?
So I live in the San Jose and Santa Clara area, and this is an area with really, really high vaccination rates because I think that people in this area really realize that this is a good way to take care of themselves as well as their family. But that doesn't mean that our schools are necessarily rid of absences, because I can definitely see that there are a bunch of students missing in each of my classes. And I do know that teachers are attempting to make this easier for students by posting online assignments and trying to move everything as online as possible. But I do think that being absent for so long can cause a lot of stress for students because they're going to have to catch up with all of these assignments when they come back, which is one of the ways that COVID-19 could have been impacting students' mental health. Elias, do you have any additions about your area?
Yeah, so my school, like everybody else's school, went online during the pandemic for the school year of the 2020 to 2021. And unfortunately, as we come back, not everybody really returned. Some people definitely didn't return physically, and some people just haven't returned to their former selves. We've also suffered from a lack of activities and events that we used to have at school before the pandemic. And I just feel like since the pandemic, we still haven't fully returned.
Let's ask an expert. Let's welcome Dr. Arash, who's a pediatrician and adolescent health provider at Stanford. He's a medical director of Stanford Teen Van. What role do you play in Stanford's Teen Van, Arash?
Hi, everyone, and thanks for having me. I'm really glad to be here. The Stanford Teen Van, I'm the medical director, as you said. I lead a team that works on a mobile health unit that's been around for now 25 years as part of Stanford Children's Hospital and Stanford Children's Health. Basically have clinics in a 39-foot RV, recreational vehicle, that's been customized to have 2 clinic exam rooms, just like you would have in any other clinic. And we provide comprehensive health services to young people who either are homeless, are uninsured or underinsured, or don't have access to the type of health care they need. We provide things like regular medical care and preventative care, vaccinations, as well as reproductive health care and mental health care as well. And we also have started doing a lot more what we call social determinants of health, trying to address some of the things in our lives that might have negative or positive impacts on our health, like housing insecurity, food insecurity, or not having access to adequate food in the home, things like that as well.
You work a lot with teens. Could you tell us a little bit how COVID-19 has impacted the services that you are able to provide to teens with the Teen Van?
It had a huge impact, actually. So just like everybody else, in March 2 years ago, we started hearing grumblings of different cities around the world being locked down and kind of wondered what that actually meant because we've never experienced that before. That day or two before we started hearing that the Bay Area was going to lock down too, it was really confusing. And Our van usually partners with different sites throughout the Bay Area. Schools, high schools, community centers, teen centers, places that serve young people. And all of those places suddenly were shut down when we went into that initial lockdown. Really kind of had to think about, well, what are we going to do? We have this resource, which is a combination of a mobile health clinic and really committed staff that included a doctor, a nurse, a couple of medical assistants, and a social worker, and a mental health person, and a nutritionist, and we had all these people. And we knew that we could contribute somehow to the lives of young people and their families during worldwide crisis. But it took us a couple of weeks to figure it out. And what we ended up doing was continuing to provide some of the healthcare, whether it was mental health care, or reproductive health care, or physical health care that our existing patients needed. Some of that was through telehealth, whether that was FaceTime or phone calls or computer visits, Zoom visits, things like that. Some of it was actually in person, and we tried to be as safe as we possibly could, outdoors and with masks and things like that. The other part of it really became, how do we provide services to the communities that our young people were coming from, including their parents? Because it was becoming really clear that there were some people in some communities that were getting hit harder by this pandemic and by the virus. And they were having trouble getting testing. They were having trouble getting information and healthcare and masks and food and stuff like that. And so we really shifted some of our efforts to that and started providing community-based testing in some of the least well-served communities in the Bay Area, providing, as well, as I mentioned before, sort of addressing issues of food insecurity, helping pay for people's groceries and sometimes even rent and utilities and things like that while their parents were sick at home and unable to work, or their parents were in a hospital or an ICU. So we really kind of shifted for quite a while towards COVID-related care for the communities that were hardest hit and least able to get the care that they needed during this pandemic.
So, kind of branching from the topic from the effects of COVID-19, I wanted to focus a little bit more on the effects it might have had specifically on adolescents. So, like many of you, you probably have had a friend who got COVID. And for me, I have a friend who got COVID a couple weeks ago, and I could tell that she was definitely struggling with isolation. She was constantly bored, and she wasn't really interacting with that many people besides her family, which was also limited. So I was wondering if other people had similar experiences, and specifically in the youth you've worked with.
At this point, we've all probably know somebody who's experienced the virus after almost 2 years of this. Many of our patients have. Like I mentioned, our patients tend to come from communities that don't have the opportunity. Often their families don't have the opportunity to work from home like many of us were able to. Some of them even didn't have the opportunity to be in school from home because they didn't have good internet access or didn't have computers and things like that. If their parents had to go to work and they were told that, either bring your own mask or you don't need a mask in the early days, many of them got the virus, brought it home, not knowing, and got their children and other family members sick as well. And so we had a lot of patients who, in the early days and even afterwards, were testing positive and who had family members who were hit hard. I mean, it was interesting to hear their experiences and how they felt about it. And, obviously there's a lot of concern for their loved ones. You have a sick mother or father who is either in the hospital or at home and you can't talk to them. If you're lucky, they're behind a closed door with masks on for 10 days until they get better or longer. If you're unlucky, they're in the hospital and you can't see them and you can only hopefully talk to them if they're doing okay. I mean, all of those things are incredibly stressful and can be really traumatic, as you can imagine, or maybe even some of you experienced. So that was part of it. The other part was having gotten it themselves early on. For example, some of the patients or our patients were struggling with feelings of the stigma around this. Like, how come I got it? Should I tell people? Will people not want to be around me? All these sorts of feelings that we may get around an infectious disease that actually isn't our fault. They may have been exposed to through their family members' work environment and things like that. I think a lot of that has shifted more recently as we're dealing with variants like Omicron that are incredibly contagious and infectious. And whereas before, many of us could really stay out of the way of the virus if we tried really hard, these days, or this in the last month or so, the last few weeks of 2021 and the first few weeks of 2022, there are just so many people who got exposed to the virus and experienced it who have no idea where they got it from and weren't doing anything that was, quote, wrong. They were wearing their masks, they were staying away from people, all that sort of stuff. just because this virus was so contagious. There are people who feel I've spent 2 years avoiding this and now I got it. What does that say about me? What did I do wrong? And the reality is that they didn't do anything wrong at this point. If you've been able to stay away from the virus for 2 years, that's amazing. And right now, it's just such a different time. The masks that may have worked in the past partially failed us recently, requiring even stronger and stronger masks to protect ourselves from this. So it's been an interesting journey. And I think a lot of the young people that we've seen have gone through a lot of emotions dealing with their family members getting this sense of hopefully surviving early on. And then as the pandemic has gone on and that isolation has continued, and they may have gotten it and dealing with all the emotions around that. It's a lot to deal with. It's taken its toll, I think, as you guys have probably been talking about.